Good day, this is Shang Salasta from BSN 12H. In this video, I will be performing a demonstration on perineal flushing. So, perineal flushing is done to clean perineal area and to remove normal perineal secretion and odors. So, before starting with the process, we should make sure to prepare all the materials needed like the cotton, balls, cleansing solution, the water, and also the basin. And after that is preparing and arranging these materials ahead will help us save time, be efficient during the process. So next is we should perform hand hygiene by washing and hand sanitizing. So this precaution from potential spread of unwanted microorganisms. So after that is we'll explain the process to the patient. So explaining the process will let the patient know how to cooperate during the process. Okay, so good day, ma'am. My name is Charles Sacalasta, your student nurse for today. So may I know your name and your birthday, please?
16 Romeo, July 20.
Okay, thank you. So today, ma'am, I will be doing perineal flushing. So I will be cleaning your perineal area to provide you comfort and make you feel refreshed. Okay, so then we'll also screen the patient by closing our curtains and locking the doors to provide privacy. Okay, so next is we'll position the patient into the dorsal recumbent position to make our patient comfortable, and this will help us more access to the perineum area. So since the patient is already in dorsal recumbent position, so let's start by and also that put the bedpan and sheet under the buttocks, and this will prevent the bed from becoming soiled. Okay, first I will going to put the basin and spread the towel evenly. Okay. So now we'll drape the patient, making sure to only expose only the parts up to be cleansed. Now we're going to expose the area to be cleansed. Okay, now so this will lessen the embarrassment and helps in providing warmth. So we'll also wear our gloves for infection control and precaution. Okay, now I am done inserting our gloves. So after that is we'll start the process by flushing the perineal area with warm water. So while doing this is we'll also note for the particular areas for presence of the inflammation or swelling. Okay. So now, using our pick of forceps, we'll get a cotton ball soaked in cleansing solution. So making sure to maintain its sterility. Now I am going to put this, and then using the cotton balls, we'll start cleansing the external genitalia, starting from the middle of the symphysis pubis down to the anus. So we should not retrace a stroke to prevent contamination. Okay. Okay, down to anus. And then discard the used cotton balls. So next is using the second cotton ball. We'll cleanse from the mons pubis in figure of 7 by way of internal labia or labia minora towards the anus. So we need to clean this area because most secretion that tend to collect around the labia minora can facilitate bacterial growth. Okay. And discard the used cotton and use another cleansing cotton to the other side. Okay, so next, and then we'll also do uh, the next using the fourth cotton ball. So fourth cotton ball will cleanse starting from mons pubis in figure of 7 by way of external labium or labia majora towards the anus. Okay, let's start use another cotton ball for the opposite side. Okay, start as well. So next is using a new cotton ball will cleanse the groin. So we start from the groin going up to the thigh, and then we'll also clean the groin using the other side of the same cotton ball. And then start it and use another cotton ball. Okay. So after that is we'll now flush the perineum thoroughly with sterile warm water. Okay. So we'll dry it using dry cotton balls following the same stroke we did earlier. So we should dry the area because moisture can promote bacterial growth. So starting from the midline of the symphysis pubis, then down to the anus. So one stroke each down to the anus. Discard the dry cotton ball. And then using the figure 7, we'll dry from the labia minora towards the anus and do the same on the other side. Discard the first and get the new cotton ball for the other side. So next is the labia majora. Try this one and use other new cotton ball for the opposite side. Okay, so next is the groin. So starting from the groin, then going up the thighs. Okay, first. Okay, use another cotton ball for the opposite side. Okay. So now we're done drying. We'll now remove the bedpan gently. Okay, I'm going to get this man set aside. So, and then we'll let our patient turn to the side so that we can clean the butt. Okay, ma'am, can you turn aside? Right now, I am going to clean your butt. So, we'll also have to clean the buttocks to provide comfort. So, using a cotton ball, we'll clean the side of the buttocks. So, both sides, different cotton balls. Another one for the opposite side of the buttocks. Okay. So now, we are done in cleansing. We'll now let our patient turn on her back and help her lay down comfortable. Okay, ma'am, can you lay down? Very comfortable with it? Okay, thank you. So, we'll also spray the antiseptic as needed to promote healing. So, and then we'll put the perineal pad with an upside down motion to prevent contamination of the vagina and the urethra from the anal area. So we have here a sanitary pad, and we will attach the pad to the underwear and let the patient do it. Okay, so lastly is will now do an aftercare of the materials used. Now I'm going to discard the the pad, and now I am going to remove the gloves. Then discard it as well. And after that is I am going to perform hand hygiene. And then we'll also record and document the process done and make sure to include findings like redness in the perineum and the discharges noted during the process. And after that is perform hand washing and hand sanitizing.